Looks like we're live, Kathryn.
All right. All right, everyone. Well, it's just after 1 o'clock, so I wanted to welcome you all on board to this session today. Welcome to another live event here on the 17th floor. As a reminder, the 17th floor is an online community focused on the growing practice of human capital management, which gathers Canadian HR, accounting, and payroll professionals together for peer-to-peer engagement, education, and mentorship. Every month, we host a live expert panel featuring special industry guests in which we and our members chat about our experiences uplifting businesses by elevating our employees. So my name is Kathryn Hill, and I've worked in the human resources, payroll, benefits, and finance field for over 42 years. I think I started when I was 10. I've worked with a company that had offices in Germany, Australia, Canada, and the USA. So I've had lots of opportunities to meet people from around the world and find out that benefits are not the same in every country. Today we will talk about employee benefits programs after the COVID pandemic, since people's needs have changed in many ways. Today, NPI has asked Graham Young to join us. He's the Director of Employee Benefits at Capcorp. Graham joined Capcorp Financial in 2014, managing and directing the employee benefits practice. With a forward-looking approach to supporting clients, Graham works with the team to ensure advisors continuously monitor industry programs and trends and regularly consults in the benefits and HR technology. As a certified financial planner, Graham is also uniquely positioned to provide resources and advice to individuals and organizations. Graham currently represents Capcorp as the chair of the Board of Benefits Alliance, a not-for-profit in the benefits industry that promotes education and advocacy on behalf of benefits advisors and their clients. So I'd like to welcome Graham, and I hope you find this session very informative. Feel free to ask any questions or to comment on the live chat. If you're watching us on YouTube or on the comments below the screen, if you're watching on our website. So I'd like to open the session by asking Graham, you've been in benefits a long time. What's your current thoughts on the market today for benefits programs?
I think it's interesting. It's really shifted a lot in the last couple of years. For a long time, it was always the conversations of what are the carriers doing and what is the next thing they're bringing out, and drug management and some of these hot topics. But it's really turned the other way, and companies are really trying to figure out how to use their money wisely, and where to put that money, right? So there's trade-offs with everything, and we've got a very diverse workforce, and there's a lot of different needs for different people, and it's really hard to satisfy all those needs. So I think that's the biggest shift. It's gone from just that carrier side to looking more internally about what you're doing.
Okay, what's the best way for an employer to approach a benefits renewal? What do you suggest that they take the time to look at?
I think it's that taking that step back first to say, what is the goal here? Like, what are we trying to do? We've got employers that might say, listen, I just need a plan. I need to compete with these organizations. Get me on par with that, and I'm happy. We've got other companies that say, listen, we want to be ahead because, for example, we are a green technology organization, and we want to promote sustainability in our pension plan and our investments philosophy and all of those things. So it's really trying to figure out what your value proposition is. There's a lot of not-for-profits, for example, who may not be able to pay as much on the salary scale, so they want to have a little bit higher level of benefits to compensate on their total compensation. So it's really, you got to first figure out what you're looking for, because really it's if until you really know what that core value is that you want to offer, you're really shooting in the dark, to be honest with you.
Do you see any companies doing like focus groups with their employees to find out what they really need?
Absolutely. So we are doing way more employee survey work than we have ever done. We used to do it, here and there before COVID, but now it's a huge part of our practice, and it's all about asking them the right questions to get to the core of what they value and what they're looking for, but also their experiences too, because you want to make sure that they're the providers you have and the partners you're using, the vendors you're using, you want to make sure they're doing what they're supposed to be doing. And a lot of that is, if you have hundreds and hundreds of employees, for example, you can't talk to every one of them and ask them how their service experience is going. So it's even to that level as well.
Yeah, I know. And I mean, I remember a situation where I had a president asking me that he wanted, bifocal glasses, and the new engineering, uh, employee was saying, but I want to have massage twice a week. So it's really hard to find that balance. And obviously, as an HR payroll benefits person, you want to try and help the employees. You want them to understand, they go into the dentist office and find out their kids' braces are going to cost $6,000, and they're just floored. But if you talk to them about things like, okay, so does your spouse have coverage? Whose birthday's first? Who can you use? Is there a healthcare spending account? Can you get like monthly payments to the dentist? I think that's the most important part from an internal perspective, is to be able to help your employees, use their benefits the best way.
Mm-hmm.
I've
Yeah,
seen, so go ahead.
I was just going to say, we're seeing a lot of employers that are just actually taking the time to level set and say, hey, does everybody remember what we have? Does everybody actually know what we have in the first place? Because a lot of times they don't really think about it until they need to use it, but they may be missing out on something that they forgot that is in there. So you're right. It's definitely, there's a lot of different needs, but sometimes you just have to remind them what's there as well.
I think some of the benefits providers also have great sites that show how much you've used to date. Like, oh, where am I on that physio? I've had like 10 sessions and I get 80%, and how much have I got left? And, or how much have I used of, say, private health care? What have I got left? So I think that's really helpful too, is employees, when they're talking to those benefits providers, could always say, well, is there some place I can see how much I've used up, sort of thing? Because I think that's valuable to the employee. And things like EAP programs. I remember giving all the employees, when we rolled out an EA program, a little card with the 1-800 number. And I said, put it on your fridge at home and say to your kids, especially your teenagers, if you're ever struggling and you want to call someone, call this number. So it doesn't mean that they have to, go to the phone book and try and find something. There's a number there that's available 24 hours a day. So I think as an employer and as a, mom or dad, you want to help your kids get through whatever situations they're facing.
Yeah, that's an interesting comment. That's one area that we haven't seen a change. So before COVID, a lot of people wanted to call into an EAP and talk to somebody and probably see them in person. And that's still the case. It's very interesting. A lot of the EAP providers and carriers have brought out a lot of new fancy, mobile apps and websites, but still the large population just wants to talk to somebody on the phone and get in person.
Yeah, I know the in-person, I always miss that when in COVID, I was sitting at home and I used to have my door open and, at least twice a day, somebody'd show up in my office. Oh, God, I just wanted to ask you about this. Or, I'm kind of having a problem with my manager. They wouldn't feel as comfortable picking up the phone and calling it. But if I have to have the door open, and I always had the candy jar there, so that I always enticed them in the door, they get an excuse to come in to talk to me. But I think that in COVID, so have you seen a change in how employers think about benefits after going through COVID?
Yeah. So like I was saying about the trying to figure out where to best spend your dollars, that's really what we're seeing, is that there's more scrutiny on things that are being used and things that are not being used, and then correlating it with that survey data to see what they value, right? Because you can spend a ton of money on one area, but if the employees don't care about that area, it doesn't matter. So I think that's the big thing, is it's trying to connect it. Now you're never going to connect them all, but if you can get those core things and direct the money to where they value it the most, and to your point, like if you're hiring a younger workforce, it's probably massages and it's probably eyeglasses and things like that. But yeah, it's all about trying to get that connection to the employees to make it make sense.
I know my daughter just started a job, and the most exciting part is she can buy running shoes.
Yeah.
And I said, yeah, but I think that's taxable, honey. Just a heads up.
Yeah, and that's interesting. There's definitely more companies doing that these days, providing those taxable lifestyle or health or lifestyle spending accounts. Before COVID, most people would say, "Well, that's silly. It's taxable. Just give them some salary or a bonus or something." But being able to connect it to they want this value and this benefit, they're okay to pay the tax on it. They just want to understand what they have from you and can see it clearly. So sometimes it works.
Yeah, I think it's the attractiveness of what they can buy with their money.
Mm-hmm.
There are now many levels of age groups and companies. What are some ways to address this variety of employees and their various needs?
So a lot of it is trying to give that flexibility to direct the money where they see fit. We're still seeing a hesitation to go to full, what we would call traditional flexible benefits programs where everybody can totally shop, because it is tough to keep them the cost in check for those in the long term. So we're seeing more people looking towards a healthcare spending account, or even combined limits where, in the past you used to have individual limits for, say, massage and physio and chiro and all those separate things. Maybe it's just one big bucket to say, okay, here's what you have, you direct it as you see fit. And I think that's really what it's about, is trying to give that flexibility, and again, trying to get them the ability to use the money and the value for where they see fit.
Yeah, no, I think, for example, in a healthcare spending, you think of that famous, I got to get those braces on. And, if maybe I run out of, money with the core plan, and then you think, wow, I can use my healthcare spending account.
Mm-hmm.
That's a good use of healthcare spending. And then from an employer perspective, I always found that people, when the healthcare spending is not always used 100%, so from an employer cost wise, it's actually, beneficial in some ways, because if you pay for a flat benefits program, you're putting the money in whether somebody used it or not. And healthcare spending, you're putting it aside for the employees to use, but if they don't use it, you still don't have to put it out. So it was very revealing after the first year or two when we introduced that healthcare spending. People loved it because they could buy their bifocals if you wanted, or the extra massage, so they were both happy. But it also provided people the chance to say, oh, look, I can use that. Like I can get 2 more massages. I just had a knee operation and I've got to go for more, physio this year that I would normally. So,
Mm-hmm.
the $500 limit is not really great in a year where I've torn my ACL, MCL, etc.
Mm-hmm.
Have companies been adding more mental health coverages programs after COVID?
Yeah, so we, in the last certainly the last 24 months, probably have increased that mental health bucket of practitioners. We've increased that far more than any other change in all of our benefit plans. So often people are separating that amount out, and not only are they making it bigger, but they're expanding the types of practitioners that can be covered under it. We've always traditionally called it the psychology bucket. But the reality is there's, social workers, there's psychotherapists, there's clinical counselors, there's marriage and family therapists. So and there's also differences in provinces too. So it's really, I think we as an industry have done a bad job in framing that. It should be the mental health benefit. Obviously I think an EAP still stands strong. We've put in more of those. Definitely, if your budget is struggling, that is the best way to get going. But EAP is more of a shorter term, get you through a situation, and then the mental health bucket is to help you with those longer term needs. But we're seeing limits. Most companies double, triple, even increase those greater. It's right in line with, if you look at the federal government, their employees, they went up to a $5,000 annual amount. So it's definitely, I personally think, the best money spent. I think when you see claims for that, you know that it's not abuse. You know that somebody's not looking to go speak to somebody just to spend some money in the benefits plan. So I think it's fantastic.
I know I had a situation where I had a co-op student come in, and obviously the co-op student wasn't covered under our benefits plan, and the manager called me and said he needs help. And I said, I'm sure that his parents, if they have a benefits plan, that they have coverage for him. But of course, he didn't want to reach out to his parents. And I said, well, even if he knows the company that the mom and dad work for, and he knows which agency like Sun Life, you could always call the 1-800 number. And, I do it privacy. They can't, tell anybody about it, but maybe you could reach that way. But what I did is, I worked to put together a list of all the different help agencies in the city where he was. And we actually ended up going out and getting a special program because we were very concerned. So sometimes I think you have to look at the situation and address, the best way to handle it. It may cost you a little more, but, I always look back to think, well, I wouldn't have wanted to come back from the weekend and had, a tragic event happen. So, sometimes I think, I've even heard of people going to unlimited limits in mental health. Is that something you've seen?
I haven't seen that, to be honest with you. The challenge is not necessarily the want to go to that. It's whether or not the carrier will do it.
Okay.
You typically have to be a pretty large plan to get them to agree to it. They typically, underwriters don't like unlimited risk. So yeah, we haven't seen that. We've seen quite a few go up to that, 2,000, 2,500, 3,000 level. But I would say the limitation is the carrier largely for clients.
Yeah, I think it's important too, especially when you've got kids going off for their first year of university. It's always a stressful time. So when they leave the home, you want them to know, hey, you've got help here. If you're having a bad, it's exam time, you got roommate issues or dorm issues. I think it's important for them to have the avenue to reach out to someone and feel like they've got openings. Are companies still offering flexible benefits plans where employees choose different level of coverage, or is that phasing out?
So what I'm generally seeing is companies that have offered it in the past are typically staying with it because it's hard to change from it. But we're not seeing as many go that way as we have in the past. We see a lot of people evaluate it and look at it, but it's a really big challenge with the budget. And certainly we're seeing more companies where they're paying more share of the premium versus the employees paying it. So those models, a traditional flex model works really well when, as employees choose higher options, they pay more of the premium. So we're seeing that as less of an option because there are more companies that are trying to be competitive in the job market by paying for a lot of the benefits.
Yeah, no, I think I was involved when I think one of the first flexible plans ever came out with the carrier back in the 80s. And it was such a hard decision. Option A was this, option B was this, option C, but there was restrictions like, oh, if you choose option A on dental, you have to stay there 2 years. So, and we just had a comment since
yeah, I think we have a
comment here. So, so many plans have a yearly maximum of $500 for massage therapy. That isn't even a 4 1-hour massages in a year. In my opinion, the benefit is useless. So I think that's what we just talked about. The healthcare spending is attractive in that sense. But what's your comment on it?
Yeah. So, but I think the comment there is that a lot of plans have not indexed the coverage for inflation, right? So, for the longest time, probably 10 plus years, a $400 or $500 benefit for massage was seen as the standard. But as you know, inflation in healthcare is massive. So that you're right. It used to be where you could go for an hour massage and it might be $80, $75, but now you're $120, $130. So it is eating that up. So I definitely agree that we have to think about benefits as that inflationary part, and we do need to think about increasing that benefit. More I'm seeing are shifting to things like healthcare spending accounts, and it's purely just to try to keep the budget in line for the company, and still give more benefit to the employee.
Yeah. Do you see any decline in company benefit offerings? Like our companies, because the cost of things going up so much these days, do you see any declines in companies being able to provide benefits plans?
So I would say no. The only thing I've seen actually is more companies looking at things like long-term disability. And it's very interesting because philosophically, in my opinion, I think it's one of the most important benefits, because if you get disabled, I'm 42. If I were to become disabled and looking at my career ahead, that's a lot of protection. But we're seeing more and more that employees just some of them aren't valuing it. So they just said, you know what, listen, I'm okay to take the risk. I think I'm okay. I want to put my money somewhere else. And typically where employees pay that premium, it can be a tough conversation, especially in jobs with lower incomes. You know, if you were having to ask an employee to pay $75 or $100 a month for long-term disability premiums, that can be tough. So I think that's the only one I'm having more conversations about getting rid of, but I will say it's not without challenges.
Yeah, no, I mean, I think that's when you're looking at your benefits, you're trying to also look at what are your premiums and what are the claims. I remember looking one time when we were spending $35,000 a year on semi-private rooms. And then I looked at the experience and like 3 people have been able to get it.
Mm-hmm.
So then I said to my boss, well, what about if we took that 35,000 and divided it among our 300 employees and gave them like $500 extra each for healthcare spending? You know, and then I said, if you did happen to end up in a semi-private room, you know, the healthcare spending would provide a couple nights, you know, 3 or 4 nights, for example. So it was a balance, but when I looked at experience and cost, you know, it was like, you know, we're really getting the bang for the buck out of what we're spending. And, you know, even another one for years, it was common to have accidental death and dismemberment benefits. And I mean, that was expensive, you know, and I think for 20 years, we never, ever, ever had a claim. So finally, one time I said, well, you know what? Maybe we should look at, you know, not having that benefit and maybe having an EAP benefit,
Mm-hmm.
which all of a sudden turned around. Now we had 400 employees plus their spouses plus their kids all having something to work with.
Mm-hmm.
I mean, you always want to ensure that risky thing, you know, somebody has a tragic accident and they're in hospital for a long time. But, you know, the money that goes into that benefit is always a weight sort of thing.
Mm-hmm.
With the talk about National Pharmacare and the National Dental Program, are employers looking to integrate their plans with these offerings? Is that possible?
So the answer is yes. I would say every employer we talk to would love to try to integrate and try to save some cost in their plan. I think the reality is the only thing we know now is the National Dental Care Program.
Mm-hmm.
It's pretty much impossible to integrate with because it's all based on household income. So essentially, if you earn under about $90,000 in your household, you can start claiming some benefits, assuming you don't have other coverage. So as soon as you have a private plan, you're excluded from getting that coverage. And where it's based on family income, it's too hard for an employer to know, listen, I know my employee's salary, but I don't know their spouse's salary, right? And the other challenge is it's really not that big of a benefit relative to most dental plans. It's a pretty minimal amount. So certainly if you have any major work to be done, it's not really going to get you too far. The most you can get out of it per person is about $600 or so a year. But that's if you're in the lowest income bracket that they look at. So we haven't seen anything there. And National Pharmacare, the issue there is we don't know what it's going to look like. We don't know if it's going to come at all. I personally just signed a letter to the Prime Minister earlier this week about our opinion on it. And we certainly feel that there's really some moves that the government can make to help private plans, and it would strengthen the health of private plans, and it would save them from having to go to a full pharmacare program. The NDP is proposing what's called a single payer pharmacare program, which means that there would only be one drug card to pay all drugs in Canada. So employers wouldn't be able to have a drug plan. And the challenges with that is that what drugs are you going to cover? So private plans typically cover 2 to 3 times more drugs than a provincial plan would. So what's that formulary? So I personally think that, we really just have to look at, and it's part of the healthcare conversation in general, that we need to reevaluate how we're delivering healthcare in the country. And big things like there should be no reason why if you go into the hospital with cancer that you're getting a prescription and having to fill it outside of the hospital. That drug should be covered through the hospital somehow, or some sort of reimbursement. Things like really rare stuff. We've had clients where an employee's dependent needed a drug that cost over $1 million a year. that's not sustainable for anybody. And if the government was, negotiating just on those rare drugs and paying those rare drugs, we'd probably get a better deal for everybody. So those are what we're hoping will happen, but it's still early to see what they're going to do there.
Yeah, I find that when I, go to the drugstore and, you go to the counter to pick up your medicine and you've got drug program, it's like, oh, there's $1.25 owed, or there's, your fees. Well, your benefits plan only covers $8 and the drugstore is like $12.99. So I want another $4 from that. So it's interesting when you're trying to design a plan. There are various ways to, go to the online pharmacies and so you can actually customize your plan, maybe to encourage people, if it's a monthly maintenance drug, to do an online type of program where the fees are less expensive for the company. So I think that's a component of a plan. You have to look at all the pieces, determine where is the money going in terms of your funding.
Yeah, we've seen a lot of employers still do that. They've encouraged people to use a particular pharmacy chain or online pharmacy by giving them a bigger co-insurance, greater coverage there, versus going to one that costs more money. So that, I don't think that's going away, but the key there is the choice. People are still giving them that choice of, yes, you can get some more money, or you can pay out of pocket over here. But the drug problem we have in Canada is the pricing is all over the map. Every carrier has different pricing agreements with the pharmacies, and it's not transparent at all. So it's a very tough thing to navigate.
Are more or less companies offering retirement programs such as matching RSP contribution by employees, defined contribution pension plans, or deferred profit sharing plans?
Yeah, we're seeing a huge amount of those, and it's all the same trend of looking at your total compensation. And if you're competing for employees and you're losing out to somebody who has a plan, there's an awful lot of people who've opened plans in the last couple of years just to get that box checked. Starting with a match, they typically don't go anywhere without a match because employees don't feel the value of without that match. And I've seen some try to do voluntary plans, but those just don't seem to work out as well because they don't have that match. And typically, private businesses are using deferred profit sharing plans to try to save payroll taxes. I know you payroll folks out there would like that. We still are doing a lot of pension plans though as well, because there's still a lot of people that believe in the cachet of, I have a pension plan, and making sure that money is for retirement. Because the issue we are seeing is because of affordability in other areas, people are accessing their RSPs. And in the long term, that's not going to get them the retirement income that they need. And a lot of companies are less inclined to give them access to that because they want to make sure when they finish employment and retire that they have a successful retirement, and that reflects back on the company and the organization, right?
Yeah, Mary's asking, what are the thoughts on reviewing the benefits that government and employees offer at retirement, considering the increase in retirement due to the pandemic?
So I think I don't really think there's really much you can do in retirement. The challenge with retirement is that, we've had a couple of companies look to try to do retiree benefits for folks leaving. But it's very difficult to do. Not a lot of carriers like to do it for organizations that aren't that big. But I think definitely that's part of a conversation to see. Again, it's all about what your employees value, and if that's driving the boat, that you're hiring a lot of folks in that category that are closer to retirement, that might be something to consider. But we're seeing such a wave of the younger age group coming into the employment that the retiree benefits is less of a conversation. Even on the looking at retirement benefit programs, it's more a conversation to line them up with their competition than it is that the employees are really thinking about retirement as much.
Yeah, I think it's, as you say, the perspective on different plans. Like I know when my daughter's 25 and she's looking at benefits plans, she's calling me saying, which bucket do I pick for RSP? You know what I mean? She just doesn't, she knows she's going to get matching money. And I said, just pick the one that's, not too aggressive, that it's going to, basically, it's more important you get the money in there than it is to, be trying to buy the most high risk one going. Like I said, it's very important for you to try and invest your money. And I mean, there's a couple of new programs on the housing front. Can you tell us a little bit about those?
Yeah, and I'll just maybe answer the question I see in the chat there about the pension plans, and maybe more of a comment about investing. And I would agree that's a challenge. The world is not as simple as it used to be from an investment point of view. We could always kind of rely on stocks and bonds kind of balancing and doing their thing. But with interest rates changing and with, throwing a war in Ukraine, things really do get supercharged. And what we're seeing is that more employees are limiting the options that people have in their plans and really tightening up that slate of options so that they can't go too aggressive. It was really interesting. Early on in the pandemic, we had a lot of employees saying, well, why can't I invest in cryptocurrency or buy Bitcoin and all of these things? And that came crashing down. It's maybe up a bit since, but it's very volatile is the point. So you want to really forget the volatility and try to be as simple as you can. So we're seeing a lot of plans just default into a target date where it's most appropriate based on your age. And that seems to work really well.
Yeah, I think it's important, when you have an RSP plan, etc. I mean, I used to bring in the different investment managers just to have a lunch and learn, and that they could tell a little bit about how they're investing in funds, what parameters they use. And I can remember the poor investment manager being up there saying, oh, but I want to buy JDSU and I want to buy, Nortel. And he was saying, well, no, they don't meet the criteria. And so when those stocks went diving, I was sort of talking to him going, I'm so glad you said that.
Yeah.
Because we want employees to make an informed decision and an educated decision about the plan sort of thing. So, So are there any new programs coming out that you've seen post-COVID, like any changes in benefits that are new benefits programs?
Yeah, so we're seeing a lot more of the I want to call it fringe benefits around the core benefits. So things like more support for maternity, more support for finding your path in building your family. So that might be support for doing an adoption, freezing eggs, doing IVF, things like that. So we're seeing more of that. And then we're also seeing an expansion in EAP beyond just that core get some assistance. We're getting into mental health coaching. We're getting into more online self-serve ICBT, so internet-based cognitive behavioral therapy. So we're seeing just some of the things wrap around benefits a little bit more. And then the other things we've talked about in the core plan.
Now, what about, there seems to be our workforce has got an older population that's looking at retirement. How are you finding benefits program addressing the sort of number of people coming off your benefits programs and that kind of thing is I would say an unbalanced phase out right now with a lot of, older people reaching that magic age to retire.
Yeah, so there's definitely a lot of people trying to figure out what that looks like. There's really two things you have to look at. You have to look at, do you have the income to sustain and the retirement income, but also do you have the protection you need? And that's, do you go on provincial health coverage, for example, for drugs, or do you buy an individual health plan? So those are the things you have to start navigating. It is tricky though, because a lot of employees, they jump into retirement and they don't know where to go. So you've really got to take a few key steps closing up to retirement so that you've got full use of any options you have for conversions, for example, out of your existing plan, because you can do a lot of those without medical questions, which is, obviously when we get older, we have a few health issues or drugs we're taking. So that can be a real big factor.
There's a question here, is paid sick leave being offered by companies in the same way as in the past since COVID?
So I would definitely say people have totally reevaluated a lot of their leave programs. So that's everything from sick leave to parental leaves. We've helped a lot of folks with policies around that. But definitely, I would say more companies have looked at a more formal short-term disability program. A lot of employers didn't do that before COVID, and I think a lot of people seeing their health and being more proactive about talking about health, it made it more prevalent of like, what happens if something happens to me in the next short time, and what if I can't make it to that 4-month waiting period for long-term disability, for example. And then you throw into that, there's been changes with employment insurance. So trying to figure out, do you change when long-term disability stops or starts, and do you pay on top of employment insurance or not? So there's definitely more of that, and we're definitely having more, even just wanting help navigating a leave. So even if they don't have a short-term disability program, they just want help to understand if an employee is in a real need, what their situation is, how long they're going to be out, is there any additional support they can give them. So that's something we're seeing a lot of now as well.
What about, there was the introduction, I spoke of EI, where we have now maternity leave benefits that are 12 months or 18 months. And employers used to offer top-ups. How did that integrate when EI introduced those new programs?
Yeah, so to be honest with you, the EI has not caught up with all the changes they've made. So traditionally, when you have top-up programs to that, there's, you've got to register it with Service Canada and explain what you're doing so they know, so that when you do provide money to the employee, it doesn't affect what they're getting from EI. But it's really, they've rolled all these things out very fast, which is great for Canadians, but there's still a lot of catch up to be done on those programs. But generally speaking, as long as you're continuing to pay on top of, and or if you have a short-term disability program that replaces employment insurance along the way, in combination with long-term disability, you should be okay.
All right. So if I'm a new employer and I hired 10 people, what would be the basic employee plan you'd recommend nowadays?
I think we're seeing a lot of companies that size start with a healthcare spending account and maybe some core things like disability and some life insurance. Because the problem for startups is that you don't know where it's going to go. You're worried about budget and trying to get off the ground. So we see a lot going that way just to get started and get some coverage for employees and have something that's perfect, a lot more budgetable. But then we're seeing typically companies, when they switch into something more traditional, we're generally still recommending they go fairly, starter, simplified on that, and still have a healthcare spending account and really grow from there. It's much easier to add benefits over the years instead of taking away. We saw that a lot with tech businesses when you get a lot of startups, they want the Cadillac of everything, the best of the best, but they don't last because they run out of money. So it really is best to kind of pick a middle of the road option and get some coverage in place and then kind of grow as you grow. And like I said, that way it'll give you time to see what the employees value and get to learn what they're using and what their experience is. And that will help you drive it much better.
Yeah. What about the situation these days where a lot of employers want to work from home and, hey, I want to go back to Poland and work, live at my home country, and what happens to benefits in that case?
That's a real challenge. So a lot of benefit programs in the country rely on the employee having provincial health coverage. So the moment you're out of the province for typically more than 6 months, you lose your health coverage. There's some exceptions if you're a student, for example. But that's the problem. So the other complication to that is, can you get benefits in that other country that's comparable to what you have and that makes sense? So it's a real challenge. So that's why we're seeing a lot of employers not go that route, saying, listen, if you want to work from somewhere and we're a remote organization and you're in Canada, that's okay. Because typically when you have a plan in Canada, it doesn't matter what province folks are in, it tends to work everywhere. So that's really what we're seeing. I think we're seeing for key hires that are needing to go overseas, if they have another business in that region, we do get supplementary coverage for them to get them over there for however long they are there. But it's very dependent on where they're going and what the system is that where they'll be.
Yeah, I think from an employer perspective too, there's always the issue of tax liability. Are they now a non-resident? Because, they've gone, I'm over in Germany for 2 years.
Mm-hmm.
Wait a minute, we opened a new office in Germany. It was like, okay, take that engineer upstairs, get him on a plane, put him in Germany, and it was like, okay, but we got to ask this question. And then,
Yeah.
There's so much you learn. And in Germany, as an example, once you're in, at least for, I think it's 4 months or something, you have to go and register to let them know or something. And so he went to this office to register, and luckily he was smart enough to bring the employee from the office who spoke German. And they were like, oh yeah, well, we should be calling you and putting you in jail. I was like, oh, sorry about that. Didn't see that fine print in the German law sort of thing. So anyways, well, Graham, I really appreciate all the information. I had the opportunity to work with Graham over the last, 18, 20 years. And it's always when coming to do your benefits renewal that you get your contacts, your benefits broker to bring you different ideas. Like, think about, what about if we self-insured? What about if we added a healthcare spending? So I think there are so many options out there. As an employer, use your expert to help you rethink the package and talk to your employees. I can't remember the number of times I've had an employee come in and say, Kathy, I really wish you had X. Well, if you really did surveys, etc., or focus groups, I find focus groups are a little more helpful in the sense that you can throw out an idea at the table, and in a group with 20 people in the room, you'll be amazed the difference in people's opinions on something. I want RSP. No, I want healthcare spending. I want this. Well, why? And you ask the person for their insight, and it really depends on, one person is married and has 6 kids, and the other is single, and is living in a little bachelor apartment. So, I think it's important to see what your employees want. So is there anything you would specifically ask? You talked about doing some information searches and questions.
Yeah.
What type of questions are you asking?
Yeah, so I'll first sort of give some comments about the focus groups. So I have done focus groups with quite a few employers. I would say most employers don't use focus groups because it is very tough to control the conversation.
Okay.
And it's tough to manage the expectations that just because I'm asking about benefits doesn't mean we're going to do more in benefits, because that comes down to the finance folks telling us if we can do more in the benefits sometimes.
You got to manage expectations.
Yeah. So a lot of our questions, like we just did a fairly comprehensive one about a month or two ago, and about half the questions were just, who are you? What's your family situation? How long have you been at the organization? What's your ethnicity? What's your experience? That kind of thing. And then the other half has been, how many claims did you make last year, roughly? How was your experience with the carrier? Did they satisfy everything you were looking for? Did you find it easily? Is there any just raw feedback you have for us of your experience? And then it got into, which areas do you value the most? And then it got into, would you pay more for some of these things? In this case, there was a conversation about adding in a cost share to enhance things. So it's all about trying to tailor it around to what information you're getting to, but all the while doing it to manage the expectations that we want to understand what you value. We don't know what we're going to do with this yet, and we don't even know what's going to come out of it yet, but we want to hear from you.
All right. Well, thanks for all your input today and insight into the tricks and tips of getting the best for all your employees. I'd like to thank everybody for watching today. The webinar will be available for replay on the 17th floor site. Please feel free to share your comments and questions with us on the website, or create a forum thread to continue this conversation. Don't forget to follow the 17th floor on LinkedIn, Facebook, Instagram, and YouTube for more content on human capital management and upcoming experts like this. I'm also put out a little word to all those people going through the fires that, your 17th floor is your network. So if you need help, we're here to help you out, just to remind people that share your, compassion, etc., with those people going through, such difficult times right now. So once again, thank you for joining our event today. We hope you have learned some new information and take it back to your company and say, hey, why don't we try this? Or, when we get to benefits renewals, let's look at some of the statistics of what we spent on claims and what we paid. So have a great afternoon, everybody, and a great weekend. Thanks for your time.
Thanks, everyone.
Thanks.